My name is Bonnie Brown, and I am interested in becoming a medical sonographer. I'm interested because this is one of the only medical technologies that doesn't require radiation to get the image, and it just uses sound waves. And to me, that's super interesting. I also really like the professionalism that the medical environment provides, and that's something as a technician that you see in your day-to-day. As for experience, I worked as a COVID-19 screener for several months while I was in high school. And then once I graduated, I became a patient registration specialist at Cascade Valley Hospital. I check in for every diagnostic appointment and the day surgeries. I also register every patient in the ER and meet up with EMTs to verify the patient's identity. I also gather demographic information from patients. So I'm providing direct patient care. And with this, I have been able to get an understanding of how hospitals work and how the emergency room works. I understand the process of checking in for ultrasound appointments. I check those in. I was also able to gain a job shadow within the last few months. I spent about 10 hours with our lead ultrasound technician, Tara. She was able to show me all 3 versions of the clinical specialty areas. She showed me her own carotid artery, and she had me sit in for a hernia ultrasound, which was my aha moment. I got to see some pretty cool stuff with that. And then the next appointment was a paracentesis. So it just really confirmed for me that this is something that I wanted to do. And I got to see her talk with one-on-one with the physicians and to do her charting, all of it. All of it was super cool to see, and it's something that I would love to do. And as working as a patient registration specialist in the ER, I do work with the sick and dying. I have had patients who I've talked to, and a few minutes later they've passed away, and pretty much everyone comes in is sick, and it's pretty much the worst day of their lives, and they are uncomfortable and they're hurting, and it's important to try to make them as comfortable as possible. And as a technician, I think you can kind of help find the solution for that hurt, and I would love to be able to do that. I also am a NAC in training, so I do my clinicals at Josephine Sunset Home in Stanwood, and pretty much everyone in there is staying. So you do what you can to make their day-to-day better, and just try and brighten their day as much as you can, because dying is a part of life, and while it is unfortunate and sad, we do what we can to make the process easier. I also volunteered with hospice for a while, so I got some training in palliative care. My understanding of the 3 clinical areas is that cardiac is of the heart. I actually got to see that one-on-one, and I'll tell you what, the heart is a little bit scary on camera. Vascular was super cool to see. You got to see the blood flow patterns of the arteries and veins. And general, which is what I am choosing, which is including all of the abdominal organs and obstetrics. And they're all pretty different in the sense that you're looking at different parts of the body. Vascular, you could be looking at anything, but it's going to be veins and arteries, but it could be throughout the entire body. Cardiac's going to be heart, and general sonography, there's so much variation, and that's why I like it. It's because one day you're looking at something, and the next day it's something completely different. Also, each specialty kind of requires a different wand. Like cardiac has a machine that's a little bit more tailored to cardiac. General sonography and obstetrics, especially for obstetrics, you need a different type of probe to be able to get a better image. Since the last time I applied, I have worked hard to better myself and to get a better understanding of what this job would entail. As soon as I graduated, started a job at Cascade Valley Hospital as a patient registration specialist, as I mentioned before. And then I am doing my NAC classes at Skagit Valley Hospital. I am 2 humanities classes away from my associate's degree this spring. I plan to graduate. And I also gained that shadowing opportunity. So all of it together has really prepared me to become a sonographer, and the process of studying hard and working hard and getting used to hospital environments I am very much looking forward to it. And while I am looking forward to it, I understand that there are going to be some challenges that come with this. Ultrasound school, I heard, is very hard, and while it does sound very intimidating, I'm a very determined and resilient person. I work very hard, and I try to do my best at all times. But there are also some other challenges, including the day-to-day pains that come with ultrasound techs. I always thought that people were kind of exaggerating, but seeing it firsthand, you really do see how much force you have to exert sometimes on a bigger patient to be able to get a clear image. And it's important to take care of yourself, practice stretching and proper health. That way you're not in so much pain while you're doing this. And there's also the really big challenge of the emotional toll that this can take. It's not always going to be a super easy appointment where you're just looking at babies. There's going to be some pretty serious conditions, and you have to kind of maintain a poker face, because there's a right time and the right person to relay that information, and you're not that person as an ultrasound tech. So you do your best to be able to help find the answer, but you don't tell them yet. That's for the physician, and that's something that I think I understand, and I value professionalism in that kind of environment. And I also very much looking forward to becoming a sonographer, and I would do my absolute best to exceed your expectations if I was chosen. Thanks.